Manager here at the Department of Health, and we're going to go over the A19 backup requirements. Next slide, please. We're going to talk about the federal risk assessment, the A19 matrix, potential impacts of not submitting the required backup, and fiscal monitoring of subrecipient agencies. As a pass-through entity, DOH is required by 2 CFR 200-332 to perform a risk assessment and monitoring of our subrecipient contracts based on analysis of risk. When a subrecipient contract is executed by DOH, a risk assessment is performed. The risk assessment evaluates an entity's experience in the following areas and identifies areas where they may need additional support from DOH. We look at your federal grant management history, the management experience in the time in that current role, how complex the grant is, your financial history, your monitoring history, and your audit history. The risk level determines the backup that must be supplied with each A19. DOH has designed a matrix based on the risk assessment outcome that defines the backup for general categories. We refer to it as the A19 matrix. Contract managers and A19 approvers are responsible for reviewing all A19s and supporting documentation to determine if the costs align with the federal funding grant objectives and the DOH work plan that was submitted to the feds. Subrecipient contracts help carry out a portion of the DOH work plan. New risk assessments are performed for each new contract. For LHJs, that is every 3 years. We reassess any time that there is a material change or after FMU performs a fiscal review. Notification will be sent out to agencies if there is a change in risk level. Risk levels reflect a shared risk for both DOH and the subrecipient. Risk assessments are internal tools designed to inform technical assistance and monitoring. They are not shared with external funders. Impacts of not submitting backup appropriate for your risk is question cost. Federal auditors or SAO will question all costs that do not align with the requirements in the matrix, regardless of their allowability. In the current environment, federal funders may be less willing to waive the repayment. Another result of not submitting the appropriate backup is that your risk level could change, resulting in additional backup being required, or you could have delays in receiving your payment from DOH. Next slide, please. Next slide, sorry. We can go to the programs can ask for additional backup documentation regardless of the risk level. You're ahead of me. Backup documentation on the matrix is required for all subrecipient contracts, including LHJs, and FMU will notify each subrecipient of the backup requirements for each contract. The staff who are responsible for preparing the A19 should review the support to ensure only allowable costs are being included with the backup. We recommend that they review the A19 matrix to verify that all requirements are included with each invoice submission. The moderate and high risk requirements build on lower requirements, meaning that as the risk increases, the additional backup is required. Providing additional support allows DOH staff to identify and provide technical assistance and feedback as needed. Next slide, please. Oh, you're still ahead of me. We're not synced. Go back one, please. Sorry. There we go. We've updated the matrix to reflect changes to the CFR and provide more flexibility and clarity. You should have the A19 matrix with the version data 4626 in the chat, and we'll only highlight those changes today. Now, next slide. For salaries and benefits for LHJs, this represents the bulk of the expenses that you charge to DOH. The A19 must clearly demonstrate the staff person and the amount charged to the period. Benefits should be broken out as a separate line item. If an agency is high risk, they must also include the number of hours being charged in the A19. We updated the requirement for agencies that have electronic timekeeping systems to offer more flexibility to meet the requirement, and will accept an electronic system generated report. Next slide, please. Materials and supplies. We updated this to include invoices required for individual invoices over $10,000, regardless of risk. We moved the additional notes from being in different columns to under the category, just for ease of readability. And we changed the category name from outreach to be community meetings and materials to provide clarity. Next slide, please. Travel and training. We clarified that this is for employee travel and training. Next slide, please. For subcontractors and sub-recipients, we updated to include invoices for $10,000 regardless of the risk. That represents all of the changes that we made to the A19. And next slide, please. Any questions about A19, the backup you're supposed to supply, monitoring, the risk assessment, any of that? No? Perfect. Well, thank you. That's it.
Thank you, Nancy. Well, that is it that we have for today around fiscal monitoring. Again, if you've got questions or you think about them later, please feel free to reach out. But not seeing any questions in the chat or any hands raised, we will let you all have the gift of time. Oh, there is a question.
Yeah, we'll be sending those. Sorry, we'll be sending those out. And actually, I think we were going to drop it in chat. We can do that right now so that you have access to it. Hold on just a second and I'll drop it in chat. Go ahead.
I was trying to drop it in chat and I couldn't. So I didn't know if don't have permission, maybe.
Yeah. Deborah, do you know?
I'm actually having trouble dropping it in chat. So what I can do is I can send it out as an email.
Perfect. Perfect. Okay. Well, that'll work. Any other questions?
All right. Well, thank you all so much. Have a great day.